Well, welcome everybody. Welcome to my little webinar. I thought I would do a webinar on what the pupils can teach you about your body. And it's called Pupil Tonus, and we can learn a lot about from the pupils. So it seems to be a very popular subject. I wasn't sure, how popular it would be, but most people know about their eyes and their pupils, and you can see your pupils in your eyes changing, constricting and expanding, constricting and dilating. And so thought I would do a little talk on that. So let me share my screen and we will get moving here. Okay, so my name is Brenda Generali. I really appreciate you spending your hour with me tonight. It's a Friday night, and I know people have lives too, and really appreciate you spending the night with me. I am the president and CEO of Joyful Living Services. Our school is sanctioned by IPA. I'm very excited and happy about that. I am a comprehensive iridology instructor for IPA and a certified nutritional consultant through the American Association of Nutritional Consultants. Here's my website if you want to check us out, and the email if you want to reach me by email, and our telephone number if you want to talk to me on the telephone. Thought I'd give you just a little brief information about myself. I learned about iridology in 1983 because I had my own personal health problems. Being a mixed eye type, I definitely had digestive issues and a lot of stress at that time. And I had a friend that was seeing an iridologist. So I went and saw the iridologist, and he did an analysis for me, and I got better. And so I thought, well, how can I learn more about this? I was curious about it, and he referred me down to Dr. Jensen, Dr. Bernard Jensen down in Escondido. Took his intro class, his beginning class. I was very interested in it. Took his advanced class, got certified. And the following week, I started getting referrals from their office. So I pretty much started my career in iridology in 1989. And my main mission is to help others improve their health, basically to create joy in their life by improving their health. In 2018, I became a member of IPA. And today I see clients all over the world. I do a lot of remote readings, and my future goals are to write a book, and the title will be Iridology, The Path to Joyful Living. And I am in a fellow program through IPA. So lots of good things to come. I'm going to go over this disclaimer with you. Joyful Living Services cannot be held liable for any misuse or malpractice of any techniques taught within this webinar, nor for any injury, suffering, or distress caused by students undertaking the techniques discussed. All students must accept that they are wholly responsible for their actions relating to the practice of iridology and pupil analysis, and must adhere to the relevant laws in their country and state of residence. Students are responsible for ensuring that they have appropriate insurance for practicing in their country and state of residence. Joyful Living Services cannot be held responsible for any advice given by students to members of the public. Students must adhere to their local laws regarding the requirement for registration and or qualification as an iridologist before suggesting supplements or offering nutritional advice. And this is going to go on my Facebook page as well. So this is very important for everyone, and all students, graduates of our courses can also use this disclaimer as they wish. So let's talk about what your eyes can teach you about your health. So your eyes aren't just the window to your soul. I mean, a lot of us have heard that the eyes are the windows to the soul. They're not just the window to your soul. They also offer a glimpse into your health. Changes in your eyes can signal vision problems, diabetes, stress, even retinal detachment. And what's more, most of those you can actually see for yourself. And that's assuming that you know what to look for. So when you go see the eye doctor, what can they see? An exam eye doctors use to look into your eyes and evaluate your health is called an ophthalmoscopy. Boy, I have a hard time saying that word. So with this exam, your eye doctor can see the retina, which senses light and images, the optic disc, where the optic nerves takes the information to the brain, as well as blood vessels. So why check the pupils? Well, pupil dilation is performed to purposefully increase the size of the pupils during an eye exam so that the eye doctor can fully examine the health of the optic nerve and the retina. And if you look at this eye, this is the pupil here, and look, it is huge. This pupil is huge. So, you know, we don't normally see pupils like this. We can see enlarged pupils, but not like that. So the exam is critical to preventing and treating eye conditions that could potentially lead to vision loss. These assessments are an important part of neurological assessment because changes in the size, equality, and reactivity of the pupils can provide vital diagnostic information in a critically ill patient. So both pupils, both eyes, left and right, should be the same shape, size, and react equally to light. And I'm going to talk about that later when we go through some of the different pupil flattenings and a term called Anastocoria, where the pupils are different sizes. So I'll explain that to you later. So here are some 20 health problems that an eye exam can catch. And this is taken from the American Academy of Ophthalmology from their website. So here is a list: aneurysms, brain tumors, cancers of the blood, tissues or skin, diabetes, giant cell arteritis, high blood pressure, high cholesterol, lupus, Lyme's disease, medication toxicities, multiple sclerosis, myasthenia gravis, rheumatoid arthritis, sarcoid, oh my goodness, I can't say that word, sarcoidosis, sexually transmitted diseases, sickle cell disease, I can't say that one either, Sjogren's syndrome, stroke, thyroid disease, and vascular disease, and last, vitamin A deficiency. So it's very important to have those eye exams. Also dry eyes. So let's talk about iridology now. So here is what we call a pupil spinal map. You're probably kind of wondering, well, why are we looking at a pupil spinal map? And that's because the pupil shows us the condition of the spine in iridology. So remember, we're talking about iridology. So here, the pupil is divided into sections. Here in the light blue color, we see what's called the cervical spine. This is the first 7 vertebrae of your spine. Okay, then the yellow here, this is the thoracic spine. This is the next 12 vertebrae. Then we have the green, which shows us the lumbar spine, which is the next 5 vertebrae, and then the sacrum and coccyx, which is the lower part of the iris. The top here is called the frontal or the superior. The bottom is called ventral or inferior. And then here we have the medial sections and the inferior sections. So wherever we see flattening in the pupil, that can tell us where there could be subluxations or pinched nerves or things that could be causing problems in the body. Okay, so here I've got some spinal maps here. So here we see your spine. At the very top, at the base of your skull, is called the atlas. This is called C1. Right underneath that is called the axis, which is C2. Okay, all of these vertebrae here, C1 through C7, this is called the cervical. Okay, the cervical vertebrae. T1 through T12 is the thoracic. L1, all of the L section here is called the lumbar. Sacrum is S1 through S5. This is the sacral. And down at the bottom here, this is the coccyx and the tailbone. Over here on this chart, we can see all of the vertebrae, and we can see what parts of the body can be affected when there are subluxations or when there are pinched nerves, when something is out of position. And so the idea is that if you have a vertebra that is out of placement, or if there's a subluxation or a pinched nerve, if that vertebra is pushed back into the proper position, it will release the pressure on that nerve. Therefore, the nerve supply can increase to those organs, and the organs can function better. That is the whole idea. Okay, so let's talk about the iris. This is when it gets fun, is when we're talking about the iris. So here's the pupil, right? Here's the pupil, and here the rest of this is the iris. So the pupil in the center of your iris is critical to your vision and plays a huge role in iridology. The pupil should be about 1/3 of the size of the iris. Children, on the other hand, can have much larger pupils, and that's normal. I have a lot of people in the Facebook group that submit pictures of their kids and ask me, you know, their child has a large pupil, and is that okay? And so usually with children, it's normal. Now the pupil will constrict or get small or tighten. It can also dilate or open or enlarge, okay? And that happens based on the amount of light which it's exposed to. So if you go into a dark room, your pupil should dilate. It should get big to allow more light. And if you go outside in the sun, then your pupil should constrict, okay, and get smaller or tighten when it's exposed to more light. The sphincter muscle, which is right here, this ring that you see right here, this is called the sphincter muscle. It's also called the pupillary sphincter. It's controlled by the parasympathetic nervous system, and that's what causes the pupil to constrict. And sometimes we can see this, sometimes it's gray like this, sometimes it's white, sometimes we can't even see it. If the center of the iris is orange or brown, a lot of times we can't even see the sphincter muscle. Okay, so this is usually visible inside this zone here. It's round and it contracts in order for the pupil to become smaller. So the pupil is connected to the spinal cord via the optic nerve. Now I'm going to do just a little bit of A and P here so that you can kind of see what we're talking about. So this is looking down. If you look down into the eye, so this is the outside of your eye, this is the front of your eye, and this is towards the back of your eye. Okay, so the dilator muscle, which is right here, this is the dilator muscle. It causes the pupil to dilate. Okay, and that's through the action of the sympathetic nervous system. And this action of having the eyes dilated causes a great amount of light to enter the eye. And that's because the pupil dilates, it gets big, okay? And that is when a lot of times if you go outside, you need sunglasses. So if you go from a dark room and you go outside, then all of a sudden you can't see because the pupil is still enlarged and it allows a lot of light to go into the eye. Now, when you look at the pupil through magnification, you can see the edge, which is known as a pupillary border. This is the edge of the pupil right here. Okay, right in here is the pupil. And this is called a posterior iris epithelium. Okay, so this is known as the pupillary border or pupillary ruff. Sometimes it can be gray, it can be orange, it can be brown. So if you look at your eye, right around the pupil, right next to the pupil, you're going to see a little ring. It could be gray, it could be orange, it could be red, it could be brown. What we want it to be is we want it to be black. Okay, this is a direct extension of the spine. Okay, and this is what contracts and dilates the pupils, this iris epithelium. Okay, it's made from thin muscle fibers, and it constantly performs its function all day and all night. Throughout the day, it does its job. So here are some of the things I'm going to talk about. Pupils of different sizes, okay? I'm going to talk about what's called mydriasis. I'm going to talk about meiosis. I'm going to talk about hippus and anastocoria, which is unequal pupil diameters. Okay, what that means is this means when one pupil is smaller and one pupil is larger. So pupil tonus, that's this term here, it's used in iridology and it refers to the observation of pupil deformation or flattened areas of the pupil. So your pupil should be perfectly round. Okay, it should be perfectly round. And if you look in the Facebook group, in the Iridology Facebook group, and you look at pictures that have been posted in there, or even if you look in the mirror, although sometimes you can't see it in the mirror unless it's really drastic, but if you have pictures taken of your eyes and you look at your pupils, you can see sometimes areas in the pupil that are flat. Okay, and so that is what pupil tonus has to do with. It's another means of clarification for iris signs found in an analysis. Okay, so we can also see what's called elliptical shapes, but I'm not going to have time to talk about that tonight. And the flattenings can be anywhere on the pupil. So here is what we call mydriasis. Mydriasis are what we call large pupils. Okay, like I said earlier, children tend to have larger pupils than adults. They indicate that the sympathetic nervous system is causing fight or flight response, and it's dominant because the sympathetic nervous system governs the fight or flight response. Okay, it is the sympathetic nervous system that's in control when people are in trauma or severely frightened. And what I find is that most people live in the fight or flight response. Most people live with their sympathetic nervous system on all the time. Okay, when you're stressed all the time and you're having to rush to work and you're having to rush down the freeway and and you're under stress, or you're late for a meeting or whatever, you are in that sympathetic nervous system. Okay, when you're relaxing, you're sitting in front of the television and watching something calming, or you're just calming down from exercising, or you're talking to a friend and you're relaxing, that's when you go into the parasympathetic nervous system. So people with the large pupils tend to have problems with poor digestion, weak peristalsis, little or no appetite. They can have adrenal fatigue, and they can have exhaustion. Adrenal fatigue means that the adrenals are wiped out. Okay, the adrenals are the glands that sit atop your kidneys in the back. They're the glands that give you the energy to get up and go in the morning. They give you the energy to run a little bit faster. They give you they help you deal with stress. Okay, so that's a lot of people have adrenal fatigue. It's typically better for these types of people to consume small meals. A lot of times they have trouble with the urinary tract, that's kidneys and bladder, the adrenals, and anemia. They can have problems with assimilation of nutrients. They can have a high metabolic rate, and have issues with minerals. Okay, sometimes they can have asthma, epileptic attacks, and they can create kidney stones. But on the other hand, they can be very generous, very enthusiastic, very sensitive, very intuitive. Okay, they can often become scientists or artists. Now, there are certain medications that can cause mydriasis. These include cough and cold medications, decongestants, even drugs like cocaine and marijuana. And usually the dilation caused by these medicines and these drugs are temporary, and it can wear off. Poisoning can also cause mydriasis. And if you've ever been in an automobile accident or had a head trauma, this can also cause dilated pupils. So here is an example of a brown eye or a hematogenic iris with a large pupil with mydriasis. So these people can have difficulty with being emotionally fragile. Okay, they can be compliant and generous and not able to say no. They can be easily misled and easily oppressed. So some questions to ask would be, do you feel exhausted most of the time? Do you notice a rapid heartbeat? Do you have a low sex drive? Do others see you as being big-hearted or generous? And the pupil can expand, which is amazing. The pupil can expand as much as 45% when you're looking at somebody that you love. So just think, Valentine's is coming up, right? Next month, February 14th in the United States, we celebrate Valentine's Day. And so everybody on Valentine's Day are going to be with people that they love, and their pupils are going to expand, and they're going to have really big pupils because they're going to be looking at people that they love. Meiosis, these are small pupils. Look at the difference. So those pupils that I just showed you were, were large. They were out here, right? These are very tiny, tiny pupils. Now, I'm going to tell you right now, let me go back. This pupil should have constricted when the light was shined into it. Okay, that's why we know it's mydriasis. That's why we know it's not normal. Because when we shine a light into your eye to take a picture of your eye, your pupils should shrink. Okay, it should constrict. Okay, and it should stay small. It shouldn't stay large like this. Now, this is abnormally small. It shouldn't be that tiny. So this is called meiosis. So when somebody has small pupils like this can indicate that the parasympathetic nervous system is dominant in the body. And the parasympathetic nervous system creates a more relaxed state in the body. So like I was talking about, when you're relaxing, or when you're sitting by the pool, or you're sitting nice and cozy in your chair, all nice in a bundle in blankets. Okay. This is the nervous system that governs sleep, digestion, and elimination. So people with small pupils tend to be concerned about getting enough food. They usually exhibit what's called a marked changeability, meaning one day they may be rigid, okay, and the next day flexible. One day they could be praising, and the next day they could be sarcastic, and then religious and atheistic, and egotistical and insecure. A lot of times they can have a slow heart rate, they can have contracted blood vessels, and they can have debris in the urine. So that is what it looks like to have small pupils. And here's another one. Look how small, tiny that is. Okay, they can have very slow pulse rate. They can have a need to control, if you know anybody that's controlling. They can have anxiety, nervous eating, or eating disorders. Some questions to ask would be, do you notice if you have cold hands and cold feet? Do you have a slow pulse rate, which is fewer than 60 beats per minute? Do you have extreme appetite? Do you consider yourself a perfectionist? How many people do you know? Maybe you are a perfectionist. So question is, if you are a perfectionist, do you have really small pupils? Okay, or do you know somebody that's a perfectionist? And if you look at their pupils, are they tiny? This is a good question. This could be a study that we could do. Here's another picture with meiosis, with very small pupils. And yet another. Notice these pupils. Look at these pupils. These pupils are supposed to be round. Okay, they're supposed to be perfectly round. Look, do they look perfectly round to you? They shouldn't. Okay, it should look like there's some flat areas, like right here should look flat, and here this should look flat, this should look flat. These pupils should be perfectly round, and they're not. And I'll talk about that later. Okay, hippus. This is a cool little video that I have here, and you can see that this pupil is pulsating. It's pulsating between mydriasis, which is enlarged, dilated pupil, and meiosis, which is a very small constricted pupil. And it's really kind of strange when we've got the light up to somebody's eye and their pupil starts doing this. It starts just pulsating. And we don't see it very often, but that is called hippus. So when the pupil goes into a dilated state, that's when it's letting in too much light. And when it goes into a constricted state, that's when it's letting in too little light. So the constant change can cause irritation to the nervous system. Okay, and this constant swinging back and forth causes problems. And it can lead to what we call shattered nerves, okay, and psychological traumas. It can manifest in nervous conditions like muscle cramping, anxiety, fear, irritability, insomnia, okay, and other issues. So, in cases like this, we could ask questions like if there's a history of epilepsy or OCD or anxiety, and if this person might have trouble saying no. And if they spend a lot of time, if they go from light areas to dark areas throughout the day, and if they have mood swings. So lots of things we can see from the pupil. So here, let's talk about anastocoria. So I'm going to show you some pictures of some different signs. And this is called anastocoria. So you can see here we have two eyes. We have a left eye and a right eye. And you notice here on the left eye, this pupil is larger than the pupil on the right eye. Now notice I'm saying this is the right eye. And that's because you have to imagine that this person is looking at you. Okay, so this is for person, imagine them sitting in front of you looking at you. Okay, and so this would be their right eye and this would be their left eye. So here I have also another example here of the small pupil and the large pupil, and another one here. This is a lot different, right? Here we have a constricted pupil, a meiosis, and an enlarged pupil, dilated pupil in mydriasis. So when we see this, we know that this can cause irritation to the central nervous system, and it can manifest of nervousness, anxiety, or fatigue. Okay, so same thing. We have problems when the pupil's too small or the pupil's too large. And when we have both, then the person can have both issues. They can have both meiosis and mydriasis. I have seen all of these things change. So as a person works on their health, improves their diet, takes care of their nervous system in whatever way they need to, whether it be with their diet, whether it be with improving their sleep, whether it has to do with relaxation techniques or lifestyle changes, whatever it takes to improve the function of their nervous system, I have seen this change. So most of the things that I'm going to show you, I have seen change. Here is blue eyes or lymphatic eyes showing anastocoria, whereas the right iris has a smaller pupil than the left iris. Okay, so some questions that we could ask is if there are any involuntary jerking in the arms or the legs, or if they feel like their mind is always on. Do you know people that say that their mind is always on and they can never go to sleep, or when they wake up, they can never stop thinking? Do they have a concussion, or have they had a serious blow to the head? So these are a few of the things that we ask when we see anastocoria. Here is a hematogenic brown eye, and we can see this pupil here on the right, or on, yeah, that's the right, is larger than on the left. And you can see this pupil is not perfectly round. It's flat over here. And you can see some flattening over here too. Okay, so here's another example of anastocoria. David Bowie. Who's familiar with David Bowie? Now, he suffered anastocoria after being punched. He had a fight, then it was related to a female. He got punched in the eye, and after he got punched in the eye, his pupil remained large like this. He ended up with mydriasis in his left eye. And so everybody said, oh, he's weird. He's got, a weird eye. And that kind of became part of David Bowie's image, was that he had one eye that looked different than the other. From far away, it looks like he's got a blue eye and a black eye or a brown eye, but he doesn't. It's his pupil. His pupil never constricted. It always stayed dilated. Okay, let me go through this pretty quickly here. Deformations of the pupil. We have what's called frontal flattening, ventral flattening, lateral temporal flattening, medial nasal flattening, superior temporal flattening, superior nasal flattening, inferior nasal flattening, and inferior temporal flattening. Okay, these are very common, and this is what shows us when there could be problems with the spine. It could indicate irritation, injury, spinal subluxations in the various areas. Okay, so if there are any flattened areas in the pupil, then a lot of times I'll refer people to a chiropractor or to a massage therapist or for physical therapy or some other type of physical therapy that will help to move those vertebrae and to bring everything back into place. And I have seen flattenings change. I have seen them change. I've seen them become round. So here we have frontal flattening. See how it's flat here on top? This is the top. This is called the frontal area. So when we see this, this is up at the top. This has to do with C1 through C4. Okay, this is the cervical vertebra. That has to do with the neck. Okay, this has to do with the neck. And so this can affect, when it's across here, it can affect the brain and the cerebral areas. It can affect a person's mood. They can suffer from depression, melancholy, fatigue, guilt, paranoia, and even anger. And there could be headaches. Okay, so if you know people with headaches, if you suffer from headaches on a regular basis, you can look at the pupils and see if they're flat here at the top. And what I would say on all of these, I'm going to give you the vertebra. So this is C1 through C4. So I would send this person and have them checked to see if there are any misalignments in the cervical region, which is the neck. Okay, and here is another example here where the pupil should be perfectly round and it's not, and it's flat here at the top. Here again is C1 through C4. Ventral, that's at the bottom. Ventral is at the bottom of the pupil. And here you can see flattening. It's flat. Once again, it should be perfectly round, and it's not. It's flat at the bottom. Okay, and so this has to do with the bottom of the body, right? This has to do with the bottom of the body. So this has to do with the lower spine, the hips, the buttocks, the thighs, the knees, the legs, and the feet. Everything down at the bottom. Okay, it can, there could be motor disturbances. In other words, problems with movement, walking. Okay, there could be stiffness, cramping, or pain in any areas, you know, in the bottom of the body there. Okay, there can also be sciatic problems, and that's when you have pain that goes from the hip all the way down to the toes. So this can be down in the lumbar area. So now the problem is at the legs are also pumps for blood circulation, to circulate blood up into the head. And so walking is very important. And so when we have flattening here, this can also affect the brain. Okay, it can affect the brain and the head area. Okay, and then so there can also be headaches with this also. And a lot of people have headaches, so we always need to look at the pupils when somebody has headaches. Here's another example. This is flat here on the bottom, ventral flattening. Okay, so when we see this, we not only look at what's going on in the lower part of the body, but we also look to see if somebody might have headaches. Lateral temporal flattening, this is when there's flattening, it would be close to the person's temple. Okay, so out by your ears, towards your temple, towards the outside. All right, and here, when we see flattening, there could be issues with the lungs, the bronchial tubes, the bronchioles, and even possibly the heart. Okay, there could be difficulty breathing. Like somebody could feel like maybe they can't breathe in sufficient air and oxygen, shortness of breath. This could cause asthmatic symptoms, nervous breathing, okay, and a weakness in the vital force. So very important. So if somebody's having heart palpitations, then, if they're having heart palpitations, if they're feeling like they can't get enough breath, we always check that side of the pupil to see if there's any flattenings. Okay, but there can also, if there are heart palpitations, then we can also maybe refer them to a doctor to check to make sure that they're not having cardiovascular problems. So on here, when we see flattening here, we look at T3 through T7 on the vertebra, T3 through T7. And that is for the lateral temporal flattening that has to do with the outside. So that would be towards the temple. Here you can see it again. You can see flattening here. This should be just like going perfectly nicely around here, and it's not, it's flat here. Okay, and so when we see that, then we ask questions. We never diagnose from the eye. So that's why I put that disclaimer at the beginning, because I want you to understand that we don't diagnose We never diagnose. But we do what iridology teaches us to ask questions. So I would ask questions. Do you have problems? And with iridology, what we do with an assessment is we always have somebody fill out a client intake form. So we get the history of somebody so that we know. And then that way, when we see a person or whether we do a remote reading, we know what some of the issues are. And so if they tell us, I have asthma or I have problems breathing, I feel like there's pressure, unless there's problems with the heart and a possible heart attack, then we're going to look towards, we look at the pupil to see if there's flattening and see if there's problems there. Medial nasal flattening, and this is in the middle. So right here, if you look here at this picture, this would be the right eye, this would be the right pupil and the left pupil, and the nose is right here in the center. So this would be flat towards the nose, towards your nose, right here in the center would be flat. Okay, and so this would be the left eye, the left iris, so this would be the left pupil, and it's flat here. It's actually flat in more places. It's flat here, it's flat here. But for this picture, we're just using this, and it should be going around just real nicely here, and it's not, it's flat. Okay, so medial nasal flattening. This has to do with T1 through T4, as well as C1. Okay, so it could have to do with the atlas, which is the very, very first vertebra under the skull. If that vertebra is out, then that can cause all kinds of problems and misalignment throughout the whole spine. So when we think there could be problems with C1, that's really important. This can also affect the bronchioles, the lungs, and the heart. Okay, possible difficulty with breathing, restriction of circulation to the heart. Typically issues possibly with the esophagus, the trachea, everything in the throat. Esophagus, trachea, parathyroid, thyroid, and thymus. Okay, those can be affected by poor flow of nerve supply to the organs. And spinal adjustments and acupuncture can also be really great for improving nerve supply to these areas. So once again, we ask the question. So in this case, I would ask, are you having trouble? Are you having difficulty breathing? Do you have problems, in your chest and with circulation to the heart? Do you notice problems with your throat, esophagus, anything in your esophagus or your trachea? Having any problems with your thyroid? Okay, so we always ask the questions, always communicate with the client. We never ever diagnose from the eye because we're not doctors. It's illegal in the United States to diagnose from the eyes. And so that's why when I see somebody diagnosing in the Facebook group, I get upset about that because it's illegal in the United States to do that. And so we cannot diagnose from the eye. Here is another example of medial nasal flattening right here, where it's flat. So this is somebody's right eye. Their nose would be right here. And this is by the nose area. Okay, so that's once again T1 through T4 and C1. I would send them to the chiropractor. I'd send them to the chiropractor if they have one. I'd send them for physical therapy, and I'd say, hey, check out those areas, see if there is any problems in those areas, and see what happens. Okay, superior temporal flattening. You can see here by the pictures. Here's the nose in the center. This is going to be on the top, on the outside. Okay, so you can see this here. It's flat right here. Top on the outside, so it's by the ears. And this can affect C1 through C5. So this is the cervical vertebra, C1 through C5, and it can affect blood and nerve supply to the head, ears, and the inner ear. So think of the inner ear, that has to do with balance. All right, so anybody you know that has hearing disturbances, imbalance, and vertigo, we would look at the pupil to see if there's any flattens. Also, there could be dilation of the cerebral vessels, and there could be epileptic symptoms as well. So very important to ask the questions and to ask them if they have problems in any of those areas, and to refer them to find out if their vertebrae are misaligned. Here's another one, superior temporal, same place, and you can see it's flat here. So same thing, superior temporal means up at the top, and it means by the temple or by the ear. Superior nasal, this is at the top and by the nose. So here we have the nose would be here, the nose would be here, this would be the right eye, and here we have flattening. This is flat right here where I have the arrow. Okay, this would have to do with C1 through C5. This is cervical again, and it can affect the eyes, the nose, and the throat. The eyes, the nose, and the throat. So if you know anybody that wears glasses, has vision problems, has nasal issues, has problems in their throat, okay, vision, breathing, and swallowing. Okay, this can, if you see that the pupil's flat, then that is important to get that checked out. If we have something also on this side, if there are markings on the other side, then there could be hepatic insufficiencies. Hepatic has to do with the liver, okay? And so there could be digestive issues. So when we see this, we also look for digestive issues and talk to our clients about digestive issues. Okay, here's another example of, oh, the arrow's in the wrong place. It's right here, superior nasal flattening. Now, inferior nasal, oh, you can really see that flattening. Look at that. Inferior nasal flattening, that is when it's at the bottom. Okay, it's at the bottom and it's flat. And you can see here, the nose is in the center and this is down at the bottom. Okay, this shows us inferior nasal. That means down at the bottom and towards the nose. So this would be the left eye, the nose would be here. Okay, so when we see this at the bottom, then we're talking about lumbar and sacral. Okay, so that's L1 through S5. Okay, this can cause pain in lower back and possible arthritic or rheumatic signs, disorders with the large intestine, and disturbances in the genitourinary tract, so bladder, kidneys, and bladder. Okay, so arthritic symptoms, lower back pain, rheumatic signs, large intestine issues, and kidney and bladder. There can also be issues with the sphincter muscle of the bladder, so there could be incontinence, which is very common in the elderly. So in the elderly, if you look at their eyes, you could look and see if they have flattening. And if they do, then it's possible that L1 through S5 may need some manipulation, okay? Might need to be checked out. Here's another example of inferior nasal flattening, down at the bottom and by the nose. So the nose would be here. And this would be L1 through S5. Inferior temporal, I've got two pictures on this one. This is the same person. And so here's the right eye, here's the left eye. And here you can see the pupil should be just going kind of nicely around like this, right? And here you see the flattening here. And here you see the flattening here. There's other flattening too. This is flat over here. But what we're looking at here is for inferior temporal. Inferior means at the bottom and temporal means by the ears. So the ears would be here, nose would be here, other ear would be here, okay? And so we can see it like this here at the bottom. And this would have to do with T1 through T4, which is thoracic, and T6 through T7. Okay, this would have to do with the arms and the hands. There could be weakness and possible pain in the shoulders and the arms. Okay, so if you know anybody with writer's cramp, if you know anybody that has carpal tunnel, okay, these are indications of that, okay? And so when we look, when we talk to people, we see this flattening, we can ask, you know, do you get writer's cramp? Do you have numbing and pain in your arms and your hands? And this can also have to do with the liver and the portal vein, and the heart can also be affected. So there are other questions that we need to ask when we see this. Here is another picture of that inferior temporal. This is only on one picture here. Okay, So that is the end of my presentation. Oh, and I'm ending on time, which is great. I want to thank you for being here. I'm going to go ahead and unmute everybody in a second. I want to thank you for being here. And just to let you know, I do have, if you're interested in learning iridology, learning more, I do have an upcoming class coming up in February. And it's $1,300 for the class. And then there is an IPA exam. This is IPA Level 1 and Level 2 core curriculum course. It is discounted for returning students. So my classes are open to new students and students who want to upgrade their skills. So people that have learned from other people like Jensen Iridology and other iridology, and they want to upgrade to comprehensive iridology, then I do offer discounts for that. My class is on Zoom Tuesdays and Thursday mornings, and everything's recorded. So you can take the class on your own time. If you want to, I do offer payment plans. They are flexible. I also, this is the link for the class here. I also offer private classes. Once we don't have to deal with COVID anymore and we go back to normal, I'm hoping to be traveling and teach group classes again in person. And I do one-on-one tutoring. And once again, you can reach me here at my email and on the telephone. So at this point, I'm going to stop the share and I'll open it up to questions and see if anybody has questions. So does anybody have, I see there's a couple more people here that weren't here before. Is everybody overwhelmed with all that information? Or do you have any? Yeah. And that was just a little bit. I didn't even go over everything because I only had an hour, and also didn't even touch ellipses. So that's a whole nother subject that we can see in the pupils. So any questions that you want to ask? You enjoyed it? I'm glad. I'm great. I'm very grateful that you enjoyed it. So that's the whole purpose there. I'm hoping that everybody liked it. Any questions? You can unmute yourself and you can type your questions in the chat, whatever you would like to do.
I have a question.
Okay, go ahead, Melissa.
Have you ever seen any correlation between meiosis and Parkinson's?
Yes, we have seen correlation.
Because my mother has, I think she has meiosis and she has Parkinson's. So.
And she has Parkinson's. Okay. So remember, you also want to look at the pupillary rough. Okay, the pupillary border on that.
Okay. Yeah,
definitely. Do you have any plan for sclerology classes? Oh, yes. So do you mean a webinar on sclerology? Is that what you're asking? Or are you talking about a real class? What are you asking? Both. Okay, I will tell you that IPA is in the process of certifying instructors in sclerology, which I am going to be a part of. So once that is complete, then I will be able to teach sclerology. Right now, Grand Medicine is doing that, but IPA will be handling all the certification for that as well. And a webinar, yeah, I'll get to that. What I've been trying to do is do like one subject every month. And so I will talk about sclerology. And for those of you that don't know what sclerology is, we look at the white part of the eye, and we can tell a lot about what's going on in the body right now through the sclera, and that's the white part of your eye. So yes.
Where in the eye would you look to have to get information about either glaucoma or cataracts?
Well, if
where would that
in the iris of the eye, or just in the eye in general?
In general.
In the eye, we would look usually with glaucoma. It usually looks like it's kind of, the eye is kind of bulbish, kind of roundish, kind of almost like swollen kind of looking. Cataracts, okay. We look in the pupil. All right. When we take a picture of the eye, that pupil should be black. And so if it looks kind of whitish or hazy, then a lot of times we can tell that there may be some cataracts that are forming.
Okay, so glaucoma would be a swollen.
It would kind of look swollen. It kind of looks like the eye is kind of swollen. That's the easiest way to explain that.
Okay, all right.
So you mentioned 2 courses. How many courses are involved in certification, or what does that get you, the 2 courses?
Okay, so IPA has a level 1 and a level 2 right now. And level 1 and level 2, in order to become certified by IPA, you have to pass both level 1 and level 2. Okay. And then once you pass both, and Melissa can tell you about this, can't you, Melissa? Because she's in the process right now. Thelma just went through it and she just got certified. So once you pass level 1 and level 2, then they're still working with me to make sure that you understand everything. And then once there's evaluations, and then once I feel that you are ready, then you go into the exam and you take the exam. Once you take the exam and you pass the exam, you have to pass it at 80%. Once you pass the exam, then IPA gives you a certificate, and you are then a comprehensive iridologist. And that's international. So, I'll give you 2 certificates saying that you've passed level 1 and level 2. In order to pass level 1, level 2, you have to pass all my quizzes. And I expect everybody to pass my quizzes at 100%. And in order to do that, it doesn't mean you have to pass them all at 100% the first time. People think, oh my gosh, 100%. I don't know if I could do that. But you turn in the quiz, and then if you miss anything, I let you know. I let you know, hey, you missed this one, you missed that one, and then you get to go back and figure out what the right answer is and send it back to me. And then once you've passed it, I'll let you know you passed, and you move on to the next step. And so that basically I know that you understand what has been taught, and you get that. So once you've passed all of the quizzes, then for level 1, then I issue you a level 1 certificate, and then you go on to level 2. Once you pass all the quizzes for that, then I issue a certificate for that, and then I let IPA know. I let IPA know that you have passed level 1 and level 2. And then there are 10 evaluations that need to be, that you need to do. And then once you do all those evaluations, there's a couple of last minute quizzes, and then you take the exam.
So how
And
many
I do,
levels are there after 1
I'm
and
sorry?
2? Are there more levels after 1 and 2?
Well, I can't announce that. There's something in the works. Let me just say that. So next month, there's going to be, IPA's going to have their symposium, and they're going to be making an announcement. And I'm not allowed to divulge any information about that yet.
Okay.
So, but for right now, it's level 1 and level 2. And in level 1 and level 2, you learn, I've got the syllabus, so you can go and look at the syllabus. You can see everything that you learn. By the time you're done, you will be able to, do iridology, and it's no problem. Melissa, can I put you on the spot and kind of get a testimonial here from you about your experience with the class?
Yeah, I'm a naturopathic doctor, and I've studied a little bit of iridology. I worked with an iridologist, and I realized I didn't know anything when I took this class. It's so much more in depth, and really has given me a much greater understanding. And I love it because I feel there's always going to be something new to learn with it, and it keeps it fresh. So yeah, great experience. Mhm.
Thank you. There's always something new. Thelma's here. Hey, Thelma, could you unmute and tell us about your experience with the IPA certification? She's muted. Maybe she's not there. Well, Thelma passed the IPA exam, and she's one of our graduate students, and she passed the IPA exam. But it looks like she's not there, and I don't think June Both June and Lolly looks like they dropped off. They also passed it. So in order to pass the IPA exam, there are 7 sections and you have to pass it at 80% to pass. And then I basically help you so that I make sure that you're ready to take the exam and tutor you to pass that. That's all part of the class.
Okay, thank you.
Yeah, you're welcome. Any other questions or comments or anything?
Thank you very much. It's very educational.
You're welcome. You're
Thank
welcome.
you.
You're welcome. Thank you for spending your hour. I know it's a Friday night, so thank you for spending your hour with me. I appreciate it. If you have any questions, you can contact me on Facebook, email me, call me, whatever you want to do. And if you want to take a class, let me know. Okay?
Brenda,
Thank you. Thank you.
Brenda, this is Terry. Can I ask a question?
Sure. Hi, Terry.
Hi, I raised my hand,
Oh,
but I didn't
sorry.
know if you saw it. No, that's okay. The question I have, with all the higher level of stress going around with this international illness, we'll call it,
Yeah.
are you seeing difference with people's eyes? Like I was thinking of, because I have a lot of exposure with frontline responders, and it seems like a lot of them are more stressed out. And I think about what you were talking about. What I keep concerned about is the adrenal fatigue, because a lot of them are working 12, 14-hour days. And so I know Matthew Hollister has also talked about the pulsating pupil. And so if you touched on that, I missed that. So I was just wondering what your thoughts were on that.
I did talk about the pulsating pupil. So if you missed it, I will be sending the recording out. And so you can fast forward and watch that part. Yes. So the iris remember the iris doesn't change, but the pupil changes. So, right, the pupil dilates and gets enlarged and constricts and gets small. And we're seeing a lot of changes in the sclera, because that's where we see a lot of the changes in the sclera. The sclera, a lot more blood vessels showing up, a lot more redness showing up, a lot more yellow, because anytime there's stress, it also puts stress on the liver and the nervous system. So the pulsating pupils, a lot more of the enlarged pupils. We are seeing a lot of change. It's going to be interesting to see, once all this calms down, what happens, and how long it takes for, things to normalize and for people to calm down, because it is causing a lot of stress for many people. And it's not just that, it's also politics, everything that's going on here in the United States. So not only do we have COVID, which I can say, not only do we have the issues with COVID, but we also have the politics and everything that's going on in the world with the division and everything that's going on social media. There's a lot of things going on that's causing a lot of stress to a lot of people. So one of the things that I do notice, and one of the ways that the eye does change, is that aqueous humor, or the liquid that's in the eyeball itself. So when there's more, sometimes there's more liquid, sometimes there's less liquid, and that can cause the eye to change, to look a little bit brighter or a little bit darker, and also your emotions. So when somebody's really stressed out, their eye can look brighter and the sclera can look brighter. And so we are noticing. So, yeah. And so, if you can get pictures before and after and compare, then, then I would expect that there would be we'd see changes.
Okay, because another concern I have is a lot of them are wearing like the sealed goggle type glasses, and I'm thinking, are there any thoughts on that? How that can impact the eye, or is there any concerns with that?
I don't know. I don't know about
Okay.
that. Yeah.
Okay.
I don't know about that.
Well, I know we're in Chicago and we're just seeing craziness here, and I just, my heart goes out to all these frontline workers, because they're all overtaxed right now.
Right. Right. And you know what? When it's all over, we're probably going to see a lot when it's over. There's going to be lingering effects from all that. So they're going to have, the one thing I can say is the best thing that they can do, and that all of us can do, is, just take care of the nervous system. Use the nervine herbs, use the B complexes, use anything to relax when they're not on, meditation and relaxation techniques and walking and baths and massage and acupressure and acupuncture and, any of the different complementary techniques, anything to support the nervous system, not only the immune system, but also the nervous system to deal with, with everything that's going on.
Okay, and I have a secondary question. I was talking to Pam Porter. Do you know who she is?
No, not off the
She's
top of my head.
a medical doctor of natural medicine. She's out of Clarksville, Tennessee.
Okay.
And she's seen an increase in TGAs, and most people don't even know what a TGA, but it's transient global amnesia. And the reason I'm bringing that up is because you mentioned about the eye with the spine, and that was something new. I've never heard that, and thank you so much for sharing that. And I was just wondering, because it has to do with the brain, where they just go into this amnesia phase. And I actually had one back in September, and it just like came on to know what happened. And so I was wondering, I wonder if something like that would show up in the eye area having to do with the spine. And there is a TGA Facebook group, and people are reporting very similar things, and they're seeing an increase in it. So I was wondering if that was anything you had any thoughts on.
Well, I don't know. I mean, did anybody notice your pupil at that time? If it was enlarged, or if it was very small, if it was constricted? Do you have pupil flattenings? I would wonder, first thing I would think of is that maybe you have a frontal flattening, because the frontal flattening, which is at the top, that is the flattening that can affect the brain. And then also could you have ventral flattening, because ventral flattening is at the bottom. And even though it's at the bottom, it has to do with the lower organs that can also affect the head. So those would be two flattenings I would look for. And then I would also look for this, I would also kind of wonder about the size of the pupil at that time. If there was hippus, if there was the fluctuating, the pupil enlarging, contracting, enlarging, dilating, contracting. So there's a lot of things that I would look for at that, and, even an ellipse could be possible, but, that would be something that I would have to go in. That's those are more advanced techniques in terms, and I didn't want to go over that tonight.
Well, that's really good to know, because I never thought, even in the medical world, they take shine a light in your eyes. They look at your eyes when, they're doing their assessment on you. And so it never dawned on me, it might be a good idea to take a picture of your eyes during
Sure.
that time frame, and see and then take one later and see if you see changes in it.
Right. But usually when you're having a problem like that, that's the last thing you're thinking of is, oh, I should take a picture of my eye, right? Usually you're stressed and kind of going, oh my gosh, what's going on? Or whoever's around you, So it'd be good for you to take a picture of your eye now and send it to me so I can look at it. That would be good.
Yeah, and I really want to, and I keep trying to do it with my phone, and I guess I'm not getting it right, because I keep telling you I'm going to send you pictures.
Have somebody else take your pictures. Have somebody take pictures with their phone. I have 2 videos on the website that give you an example of how to take pictures of the eyes. One is Kathy, where she is demonstrating how to take a picture of somebody else's eye. And then one of my students is demonstrating how to take a picture of your own eye. She did that in her bathroom. And so those 2 videos are on the website. You can watch those and see if that helped you.
Okay. Thank you so much again for sharing everything you've shared. I do have one other third question, if you don't mind.
Sure.
you know, cataracts are so common
Mhm,
nowadays.
mhm,
And I know in some of the people I trained under, and I think you mentioned it was at Melissa that's an ND.
mhm.
Yeah.
Right.
That I've heard some say, you know, it can be related to digestion. Because I've asked various, you know, eye doctors and holistic eye doctors, and, you know, I haven't got a satisfactory answer of that. But it's just so common. It seems like a common age-related thing. And I know you have a background in nutrition, and I was just wondering if you had any thoughts of that. Because I mean, I've had eye doctors say, well, we just don't really know.
I can give you a really simple answer. Everything is related to digestion.
No, I
Everything,
agree.
everything
Yeah.
is related to your diet. Um, and as far as cataracts, I mean, I can talk to you about that off webinar. If if you want some specific information, I can talk to you about that off webinar.
Okay. Well, I just brought that up because it's such a common problem.
It is. Yeah,
You know, everybody knows somebody that's been affected by it.
it
Maybe
is.
you could
Yeah.
do a webinar on that. Some of
I
the
don't know.
common,
I'm not, you know, it's not really my, I'm not, uh, it's not something that I'd probably do a webinar on.
yeah.
Yeah.
Okay. Well, thank you for sharing.
You're
And
welcome.
thank you for those that are listening.
You're welcome. Any other questions or comments? Thelma, are you there yet? Let me see. Let me check the chat here and see if there are any other comments. Oh, there are some questions here. Let me see. Let me see. Is there any book for sclera that you recommend? Yes, Grand Medicine. If you go to Grand Medicine, they have Sclerology. Leonard Melmer, he has books on sclerology. You can even go to, oh, do you have it? Oh, good. Yeah, and there's a sclerology chart that we use. That's a good sclerology chart that you use, and that's from Grand Medicine. You can go to my website also, joyfullivingservices.com. We sell all of the sclerology supplies. Sometimes I notice the surface of the pupil is very flat. What does that mean? The surface of the pupil. I guess I'd have to get more information on that question because I'm not sure what that means. If he's saying the top of the pupil, that's the frontal area, or what that means. How long would the sclerology class be? And do you have to have iridology first? No, you do not have to have iridology first. About how much would the sclerology class cost? I don't know the answer to that question. And how long would it be? I don't have the answer to that question either. It's in process. Grand Medicine has one now, which we do sell, which is a DVD course, but the live course is not available yet. And let me see. Do you have a second course later in the year? I'm really interested in learning, but I won't have the mental bandwidth in February. Yes, I'll probably do another one in August. I usually do 2 a year. So August is a really good time. It's after the summer. So I'll probably do another one in August. Any other questions? You're welcome. Any other questions? Okay, then I will end and say good night to everybody. This has been recorded, and I will send out the recording to everybody so that you can watch it, and feel free to share it with whoever you would like to. Okay. Okay. Good night, everybody.